All right, it's 12:30, so we will begin. Welcome, everybody. My name is Sarah Sims, and I am the manager of continuing education for the Brown School here at Washington University in St. Louis. Thank you all for joining us today for our Open Classroom program. Open Classroom is one of the Brown School's virtual and free professional development series. But beyond Open Classroom, I just like to share that we do have a plethora of different continuing education workshops available. The QR code on the screen can take you to all of our different offerings if you are interested. You can also go to brownschool.wustl.edu/professional-development. I also dropped a link to that website in the chat. So just a couple of notes before we get started on housekeeping items. First, as you have probably already noticed, this is a Zoom webinar format, which means that we can't see or hear you, but we will have time at the end for some Q&A. And so if you do have questions for our presenter today, we would love for you to drop those in the chat, and we can try to get to as many of those as we can. Also, we are recording, and I see somebody already dropped a question about this in the chat. We are recording, and so I will post the recording onto our YouTube page probably tomorrow. So you can go back, watch it again, share it with your colleagues. And that's the website for that, brownschool.wustl.edu/open classroom. That's where you can find recordings of all of our past open classrooms. Great. So I think we are ready to fully begin. So now I am going to introduce today's speaker. Let's get the title back up there. All right. So today's speaker is Kersha Deibel. She is a public health leader with over 16 years of dedicated service in the field of sexual and reproductive health care. Her career is marked by a relentless commitment to improving healthcare access and outcomes for Black women, girls, and gender-expansive people. Currently serving as the senior advisor to the president of Planned Parenthood Federation of America and Planned Parenthood Action Fund, Kersha plays a pivotal role in shaping the future of sexual and reproductive health in the United States. In this capacity, she champions evidence-based strategies to address systemic issues of healthcare inequity, particularly the enduring challenge of anti-Blackness within the healthcare system. Her leadership is driven by a vision to maximize the impact of Planned Parenthood's services and support for Black patients and communities who have long faced disparities in sexual and reproductive healthcare. Before assuming this current role, Kersha served as the president and CEO of Planned Parenthood in the Southwest Ohio region, where she oversaw the needs of over 20,000 patients annually across 6 healthcare centers. Her tenure was marked by innovative approaches to healthcare delivery and a steadfast commitment to expanding access to essential services. While she's originally from Ohio, Kersha's influence extends beyond the state. During her time in Washington, D.C., she spent nearly a decade leading and organizing with Planned Parenthood Federation of America and Planned Parenthood Action Fund. The alliteration is killing me today for some reason. In this capacity, she orchestrated winning electoral campaigns at local, state, and national levels with a focus on amplifying the voices of Black and Brown individuals, LGBTQIA+ folks, young people, and patient advocates. We are also very proud that Kersha is a Brown School alumni with a dual master's degree in public health and social work. And then finally, because we bring our whole lives to our work, right? Kersha resides in Cincinnati, Ohio with her wife, Latoya, and their perfect 5-year-old puppy, not really a puppy anymore, dog named Cardi. So I am going to turn it over to Kersha, who is here to present on how we can all navigate the landscape of reproductive health rights and justice, looking at abortion access post-Roe. Kersha, please take it away.
Thank you so much, Sarah. Thank you. And I have to just call it out that I clearly look very different from that photo that I submitted to now as I've cut off all of my hair. But it is so good to be here with y'all today. and be in company as we talk about the current state, but also the future state and the past. Explore a little bit of the past of how in the heck did we actually get into this moment where that we're in right now as it relates to reproductive health, rights, and justice. So I am going to begin sharing my screen. And Sarah's going to let me know if anything is funky up on the other side.
Looks good.
We're good? Okay, awesome. And as Sarah said, and I just have to say, I see a few people who I know in the chat. And so welcome. It is so good to see your name, especially from my old days in St. Louis when I was there, both as a grad student and as an employee of Planned Parenthood of the St. Louis region in both the advocacy and on the care side as well. As Sarah stated, I'm Kersha Deibel, Senior Advisor to the President of Planned Parenthood Federation of America and Planned Parenthood Action Fund, which is Planned Parenthood's national office. Just for context, we have 49 independently operated affiliates across the country, and we work very closely. We at the national office work very closely with each and every single one of our affiliates. In July, I made a very tough decision to transition from President and CEO at Planned Parenthood Southwest Ohio to the national office and lead and be in a space to lead this amazing work around Black health equity. Really, two things that I love, both public health and Black health equity coming together, and I could not stand to not take this incredible opportunity. My role is really uniquely focused on ensuring that Black women, girls, and gender expansive folks have access to care and services at Planned Parenthood and increasing health outcomes for our communities. Truly, I am the luckiest person in the entire world. As we know, job titles in bios are just that. They're words on a page. And so as I'm going to be spending the next hour with you, I wanted to introduce you a little bit more to who I am. While I work with affiliates all across the country, I am situated currently in the great state of Ohio, specifically in Cincinnati, Ohio. I was born and raised in Ohio in a small town called New Philadelphia. And my journey inside Planned Parenthood started as a patient. At 18, I walked into the health center here in Cincinnati on Auburn Avenue to access birth control services, and again, walked into the health center on Auburn Avenue at 21 to receive abortion care. It was the best decision I've ever made in my life. I walked out of that health center feeling like I was the only one that had power, that I was the one that had power over my body. And this organization truly has transformed both my career, but also my life and the ability to do what I want and when I need and want to do it. So I'm very fortunate for all of the years, the 16 years, including my internship with Planned Parenthood of the St. Louis region with Mevy Mead, who I know is here on the line, as well as the work that I've done inside health centers at the national office, leading electoral and campaign work, and obviously as president and CEO of Planned Parenthood Southwest Ohio, and now coming back to our national office to lead our Black Health Equity Initiative. These are things that bring me joy. The first picture you see here is a picture of me at Beyonce in London. Beyonce brings me so much joy right now. The middle photo is a photo of my wife. We have been together 11 years. This October, we're celebrating our 11th year anniversary. And the third photo is my wonderful puppy, Cardi. So here's the agenda for how we're going to be going today, what we're going to be going over. We're going to spend about 15 minutes kind of talking about a little bit about the past. Again, how did we get here to this moment? We'll spend about 20 minutes understanding the present, and then we'll spend about 15 minutes really looking towards the future. And of course, we'll hope that there's time at the end for question and answer. As you have questions, feel free to, I'm not going to pause to answer the questions, but I will make sure that we can get to those at the end of the session. Just a couple things I want to call out here. As we know, the traditional biological-based binary definitions of gender, they have limitations. And at Planned Parenthood, we strive to be inclusive of all communities who obviously access the care that is needed. Through this presentation, I am going to use language that is both gender neutral, gender specific, and anatomy specific, depending on if we're talking about experiences beyond the boundaries of gender. Example, people, or politically gendered concepts, examples, women, or a population with specific reproductive capacity like birthing people or birthing folks. We also encourage you to take care of yourself. During the session, I may be referring to things like racism, transphobia within the medical industrial complex, exploitation of Black bodies, including slavery, history, racism, sexism, transphobia, and misogyny, oppression, violence, including sexual assault. So I just really encourage that if any time you feel like you need to step out of this presentation to support your well-being, please do. And of course, you can always connect with Sarah or myself afterwards if you'd like more information. All right, so let's jump into this. Much of the content that's going to be referenced in this section actually comes from the book Reproductive Justice, an introduction written by two legendary scholars. If you don't know them, please Google after this session, both Loretta Ross, who is one of the founders of the reproductive justice movement, and Ricky Solinger, a historian and expert on reproductive politics. History tends to repeat itself, y'all, and whether you know it or not, so you might as well know it. There are here are some of the key events and periods in history that have greatly shaped reproductive freedom, not only at that time, but many of these, as we all know, continue to have an impact on reproductive rights and freedom today. So things like the US colonial period. We're not going to go all the way as far back to that moment today, but I have at the end a lot of literature that you can read on how many of these historical aspects and times in our history have actually shaped the reproductive health rights and justice movement. Legal meanings of racial differences, literally how do we define race in this country, experimentation on enslaved women by Dr. Marion J. Sims, who is the so-called founder of, or the father of gynecology, and we will go in a little bit of that today, eugenics and forced sterilization, and of course, the policing of reproduction and parenting on people of color or poor folks and brown and indigenous communities. So to begin and start to go into a little bit of this history, I'm sure many of you are already aware of this, but just so that we can all be on the same page here, the medical field has historically used race to really justify the brutal experimentation on Black bodies. During the 1800s, James Marion Sims created the field of gynecology by conducting surgical experiments exclusively on enslaved women. He operated on them without anesthesia, even when it was available, based on the racist belief that Black women were immune to pain. While Sims is widely known as the founder of gynecology, history has erased the Black women whose bodies were used to create the field itself. Of all of the women that Sims experimented on, we only know the names of three: Lucy, Betsy, and Anarcha. All three suffered from vaginal fistula, a painful tear caused by traumatic childbirth, and because they were unable to bear more children as a result, they had lost their value to the plantation owners where they lived and were handed over to Sims. A century later, the false beliefs about Black women's pain and their humanity still impact the reproductive health care they receive, and these consequences are often deadly. From the 1950s on, the sexuality and fertility of people who can get pregnant continued to heavily dominate the national policy agenda. While these policies impacted all people who can get pregnant, I'm going to use the term women and mothers to accurately just communicate the cultural narratives of this particular political discourse. Women were not permitted to make decisions about their own bodies or sexuality, and their fertility was often criminalized and considered dangerous. This war on motherhood continued into the 1960s and 70s, excluding many birthing people from legitimate motherhood, including poor women, women who weren't married, and women of color. And cultural and political authorities disqualified both white women and women of color who weren't married from authentic motherhood, but the strategies for this disqualification were racialized. For examples, white women who were unwed, white unwed mothers, were pressured to relinquish their child to adoption, aka coerced adoption. The mother of color was told that she had no choice but to birth and parent, while at the same time being made to suffer punishments for having given birth. The result of these policies, y'all, and practices was that hundreds of thousands of people had to find ways to end pregnancies, whether they intended to or not, in order to avoid the horrible experiences of coerced adoption or shamed pregnancy and motherhood stripped of resources. Abortion wasn't legal, but for a very long time, law enforcement had chose to ignore anti-abortion laws. And as part of the effort to control the sexuality and fertility of people who can get pregnant, abortion laws began to be enforced during this time period, including the criminalization of medical providers who provided abortion. This led to opportunistic, inexperienced providers taking advantage of people desperate to end their pregnancies, resulting in many injuries and deaths from unsafe abortion practices. The legacy of these opportunistic, inexperienced providers lives on today in the fight for self-managed abortion, abortion outside of the care of a medical provider to be destigmatized. And I'm sure many of us are seeing that in the national news and in the media as we're talking more and more about self-managed abortion. One specific reproductive technology that seemed to really support liberation for all was the birth control pill. First marked in the 1960s, this improved reproductive dignity and safety. But like everything else, the creation and the use of control was also racialized. For example, women and people in Puerto Rico were recruited for clinical trials for the first birth control pill with a lack of consent, a lack of full disclosure, and a lack of true informed choice. The Supreme Court's decision in Griswold versus Connecticut, I'm sure many of us are familiar with, in 1965, it finally dismantled the Comstock laws, specifically its measures to criminalize contraception and define birth control as a matter of privacy. And lastly, this zone of privacy became the zone in which people could make reproductive decisions about parenthood, contraception, abortion, and adoption. And the zone of privacy did not realize the right to reproductive choice for many people, particularly folks of color. As backlash to these advances of the civil rights era, programs of coercive sterilization were established in a number of hospitals serving communities of color. The Indian Health Service was aggressive in sterilizing patients during this time period. Because of lack of accurate records, it is extremely difficult to actually determine exactly how many sterilizations occurred. However, a Native organization, Women of All Red Nations, estimated that on some reservations, the rate of sterilization of people with uteruses was as high as 80%. Scholars have found that between 1968 and 1982, about 42%, y'all, of Native folks of childbearing age were sterilized compared to 15% of their white counterparts. And right in the midst of these sterilization efforts, Congress passed the Hyde Amendment and has continued to reaffirm support for it every year. And the Hyde Amendment prohibits the use of federal funds for abortion, which disproportionately impact low-income folks and people covered by Medicaid. The Hyde Amendment profoundly limits a pregnant person's options in ways that are consistent with and further erode older laws, policies, and social norms that aim to deny reproductive dignity to poor women and birthing people. People who supported the amendment often described poor women as bad choice makers and bad mothers who require reproductive restrictions on their sex life. So let's talk about Roe, right? The reason we're all here in this moment. You'll see here that in its 1973 decision, Roe v. Wade, the Supreme Court recognized that the right to liberty in the Constitution, which protects personal privacy, it includes the right to decide whether to continue a pregnancy. And as you can hear in that language, only reproductive choice, right? Reproductive choice, not reproductive justice or access to abortion was actually granted by this decision. So while tests of undue burden were used to determine whether state law and state level abortion restrictions violated the Constitution, we actually know that people without means were regularly unable to access care, even up until these very moments when in states where abortion is still legal, it is extremely difficult to access care, even when Roe was law of the land. And we know that people without means were regularly, again, unable to access care due to countless limitations, including lack of providers who are pro-abortion or are willing to provide highly stigmatized and regulated care that comes with a risk of being targeted by extremists. While people of all lived experiences advocated for the passage of Roe, it didn't actually ensure access to abortion for all, right? Often, white wealthy folks and middle class advocates of legal contraception and abortion were focused only on a woman's right to choose, right? As I'm sure we've seen all of the signs from many of the first waves of feminism, right? This is a women's right to choose. Their advocacy ignored the right to reproduce and parent, a crucial concern of those whose reproductive capacity in parenthood had actually been degraded throughout the US history, namely women of color. And you may have heard this before, but Roe was the floor, right? It was not the ceiling. Roe has always been really the minimum and left the ability for states to come in and restrict access to abortion care, as we have seen most predominantly over the last decade, but as you can see, even prior to that. Roe's protection of choice placed abortion in, again, that zone of privacy within which people can make reproductive decisions similar to what we talked about earlier in the Griswold versus Connecticut decision. And people with and without resources could not exercise this choice in the same way. For example, a poor person may have to decide whether to use their budget to pay for rent and food or an abortion, or a woman may not be able to actually take time off of work to access care. The limitations of Roe are also exacerbated by there being no right to health care in the United States. So not only can people not access abortion care, but also the right to health care, right? People are also struggling to access sex education and birth control and other forms of pregnancy protection. Women of color activists point out that the concept of choice doesn't actually account for the different economic, the political, and environmental context in which women, trans folks, and non-binary people live their reproductive lives. Conflating choice with reproductive freedom, they argue, disguises the ways in which laws and policies and practices and public officials differently actually punish or reward childbearing or different groups of people, as well as the different degrees of access that people have to healthcare and other necessary resources to manage sex, fertility, and parenthood. I'm sure many of us are familiar with some of this, both the language, but also these images, right? We begin to see these different messages coming from women of color who are focused on reproductive justice and white women who focused on the right to have the choice. Women of color activists also pointed out that choice, as conceived by white feminists, also really forced almost entirely a woman's ability to prevent conception and motherhood. Activists objected to the singular focus on prevention, and they argued that the right to have a child was just as crucial to women's dignity and safety and the safety of their community as the right to prevent conception. They argued that this singular focus on prevention, ignored all the histories which included enslaved women who were raped and impregnated with impunity, the massacre of Native populations, the forced sterilization and punishment for poverty, the laws that prevented folks from immigrating to the United States and prevented them and their children from being citizens, the laws that degraded so many women of color in their communities in the effort to protect white supremacy. So again, I know this is heavy, so I encourage you to take a break as you need. But this is a quote from the founder of the reproductive justice movement, Loretta Ross, and she says, "Individual choices can only be as empowering as the resources as a woman can turn to in her community." And so therefore, reproductive justice was born, the term reproductive justice. Asian Communities for Reproductive Justice, formerly known as ACRJ, now known as Forward Together, define reproductive justice as a term to describe a world when all people, all folks, all people have the economic, social, and political power and resources to make healthy decisions about their bodies, their sexuality, and reproduction for themselves, their families, and their communities in all areas of their lives. This term actually comes about at a United Nations International Conference on the Population Development in Cairo in 1994. And it was created in communities of color by communities of color, specifically 12 women of color in the global and women of the global South, as a name that truly represented their work and movement in a way that the traditional reproductive rights frame just did not. Reproductive justice was actually a response to marginalization. It was a term that was created because women of color and women of the global South were not having their experiences represented in the broader movement. Again, being blamed for overpopulation, not addressing issues of forced sterilization. There was a singular focus on abortion rights and not engaging in the fight against poverty for healthcare and other issues. It challenged this rhetoric of choice with that of justice. And it was about a person's ability to choose if and when to have children. The right of every human being not to have a child, to have a child, to parent children in safe and healthy environments, to bodily autonomy, sexual autonomy and anatomy, and gender freedom, which was more recently added. Reproductive justice is a human rights framework. And true reproductive freedom requires a living wage and universal health care, right? And it requires people to walk out of their house and feel safe from state-sanctioned violence or ICE, right? Attacking undocumented folks. It encompasses all of the determinants that influence sexual and reproductive health, parenting, and body autonomy. Reproductive justice is fundamentally different from the pro-choice, pro-abortion debates and has dominated mainstream media. And I want to emphasize the importance of the right to have a child and the right to parent, which is less mainstream than the right to have an abortion. So since the 1990s, the reproductive justice movement has influenced activism. It's influenced scholarship, academia, policy, and even healthcare in a number of domains. For example, the reproductive justice movement has worked with groups fighting to effects of toxic waste on communities of color, including the negative effects of their reproductive potential and on infant and maternal health, including environmental health. The movement pressed the CDC to include women in all public health information and treatment regarding HIV/AIDS. And here are just some examples. There are a ton of other reproductive justice organizations. I'm sure many of you on this line are from Missouri. So there's reproductive justice organizations across the country. And here are just a few. So again, reproductive justice is when all people have the economic, social, and political power and resources to make healthy choices about their bodies, sexuality, and reproduction for themselves, their families, and their communities in all aspects of their lives. I'm just going to skip over a few of these. I do want to just name that there is a multi-sided approach to reproductive health rights and justice. Of course, reproductive health organizations are organizations like Planned Parenthood. Reproductive rights organizations could also be a Planned Parenthood, right, where we're fighting for the actual access to reproductive health, and reproductive justice are the organizations that we just saw. So before we go any further, I just want to ground ourselves in the present day reality. This image certainly looks familiar to the images that we saw in the past section of this presentation. And while history in many ways is repeating itself, I just want to be really specific about where we're at right now to determine where we're going. One thing's for sure, we know that we have a lot of work cut out for us. And that work is going to require new strategies because the limiting frameworks that we've used in the past have actually fallen short. As we dig into our current moment, I just want to get one thing straight, and that is that white supremacy is alive and well. I want to say well, but I think unwell is really what the word is that I want to use. But I think you get my point. And while it's easy for us to condemn acts of white supremacy performed by white men in white nationalist movement on national news outlets, it can be more complex to actually look at the ways in which white supremacy continues to fuel the anti-abortion movement, and even more challenging to look inside of our own movements to understand how white supremacy continues to impact our own ability to imagine and fight for a better future. So again, how did we get here? We've reviewed, of course, some of the history, but I also want to just bring you into the most recent history on abortion access across the country. In June of 2022, I feel like this is a moment where it's one of those watershed moments where you remember where you were, right? In June of 2022, when the Dobbs decision came out, which overturned 50 years of precedent, y'all, 50 years of precedent and federal abortion rights. It overturned the Dobbs decision on Roe v. Wade. And that leak, if folks remember, even several weeks before that, there was a leak of the decision, and that leak of that decision galvanized state responses even before the ruling was officially released. Prior to the Dobbs case, it is crucial to understand that abortion access was far from adequate. We already talked a little bit about that, right? Even in the ways in which the states could come in and strip access. It disenfranchised and marginalized groups were disproportionately affected by the restrictions in place. And these restrictions not only limited access, but they also exacerbated disparities in healthcare. Many states have implemented stringent regulations, making it increasingly difficult for people, particularly those in low incomes, Black and Brown communities, immigrants, members of the LGBTQIA+ communities, and especially young people to be able to access the care that they needed. And today, support for abortion rights has reached historic highs, with more than 2/3 of Americans expressing their support for abortion access. More than 2/3 of people express their support for abortion access. And I think often the anti-abortion movement would have us thinking it was the opposite, right? This broad-based support underscores the significance of maintaining and expanding access to safe and legal abortion services. But despite the widespread support for abortion rights, there are Republican officials who have made their intentions clear. If they gain control of both chambers of Congress and the presidency, they will push for their federal bans on abortion. And this looming threat highlights the importance of vigilance in protecting reproductive rights and the need to engage in advocacy and activism to safeguard these rights. Now, while this discussion is predominantly focused on, of course, Roe, I just want to make sure that folks are aware that, these restrictions also impact, and many restrictions across the country over the last 10 years have also been happening to access to birth control, access to emergency contraception, access to sex education, right? Even here in the great state of Missouri as well. In an article that was published in Vox, they stated that in 2010, at the turn of the decade, state houses went red across America, and Republicans gained control of 11 state legislatures and increased their majorities in 3 more. In some places like Alabama and North Carolina, they erased Democratic majorities that had existed since the 19th century. When the votes were counted, the GOP had added 680 seats in state legislatures across the country. And y'all, bit by bit, day by day, minute by minute, and sometimes in the wee hours of the night, right, we started to see devastatingly high increase in abortion bans. Overall, more abortion restrictions were passed in 2011 than in any year since Roe was established as a right to the procedure in 1973. And just here in Ohio in 2011, there were 5 abortion bans that were passed. Similarly, we are seeing, now hundreds of abortion bans being passed across the country, and many of those in particular target states and red states where they have the GOP has really gained control in many of the states, again, including in Missouri. And these things, I think one of the fascinating parts about all of this is that they start often with children. And we're seeing, I'll talk a little bit about this in just a minute, but we're seeing some of those same parallels in the anti-trans movement, right? Where they're slowly starting with consent laws, or in the trans movement, right? Access to gender-affirming care for young people, or banning trans athletes in high school. So we're starting to see that, and starting in 2010, we saw that, and just again, a constant chip away at access to care. So with the reversal of the Roe decision on June 24th, 2022, we saw both how the absence of legal protections harms those already facing barriers to reproductive health care, including Black and Indigenous and other people of color. But after Dobbs came down, states actually moved to enforce total bans and gestational bans on abortion that were previously blocked in 21 states, including here in Missouri. And they tried to do it in Ohio, and I'll talk about that moment in just a bit. The abortion landscape at the federal level in the state has drastically changed, which is leading to new efforts to protect abortion rights and new opportunities to reimagine and rethink what does access actually look like, and how do we codify and secure abortion rights in ways that states can't chip holes in patients' ability to access care. This is a graph from the Guttmacher Institute that shows the trends in out-of-state travel during the 2010s, emphasizing that the battle for abortion rights is not a recent development. Prior to the Dobbs case, access to abortion was fragmented, and our ongoing efforts, including advocacy, demonstrations, voting, and even the way in which we provide healthcare, right? Thinking about all of the abortion doulas, abortion navigators who have been pivotal in this moment, even tech, right? I saw that there were so many grassroots organizations that popped up to secure and make sure that no matter what, patients could get the care that they needed. So not only are we fighting on the advocacy front and the political front, but also ensuring that access to care is secured on the healthcare side. And these are really reflecting our commitment to expanding access, not just going back to the pre-Roe era, because again, as we named, there were challenges even with Roe. So I'm just going to start by kind of quickly zipping through a few maps that illustrate the current patchwork. And it truly is a patchwork. And forgive me if somebody on this line knows that a state may actually look different. I think this is changing sometimes by the hour, especially in the first few months when Roe was falling. Courts, lower courts and state courts were constantly in action to both protect and dismantle access to abortion care in the states once Roe fell. But starting with these bans, bans have actually been eliminated or have eliminated all or some abortions in 21 states currently, y'all, 21 states. There have been bans that have eliminated abortion in 15 states completely, which is Alabama, Arkansas, Indiana, Idaho, Kentucky, Louisiana, Missouri, Mississippi, North Dakota, Oklahoma, South Dakota, Tennessee, Texas, Wisconsin, and West Virginia. Bans have eliminated abortions after the earliest stages of pregnancy in one state, which is Georgia, and bans on abortion between 12 to 20 weeks, are in effect in 5 states, which are Arizona, Florida, North Carolina, Nebraska, and Utah. And again, this is changing sometimes daily. At the same time, and you all know this well, states have also been working hard to protect access to abortion. There are 13 states that have constitutional protections for abortion. There are also currently 18 states plus the District of Columbia, I'm not going to read them all out, but that have statutory protections in place to protect abortion access. There are 6 states, and I do want to read these: California, New Jersey, Massachusetts, Minnesota, New Mexico, and Vermont, that have both statutory and constitutional protections. And even after a very successful run in 2022, many states are moving ahead with ballot measure work to protect access. We have Ohio. All eyes in this moment are on the great state of Ohio in 2023, and there is work happening at various stages in states around the country. As of right now, New York and Maryland are on the ballot in 2024, and exploration is underway in Arizona, Colorado, Illinois, Nebraska, Nevada, and I know lots and lots of conversations are also happening across the coalition in Missouri as well. So I think the bottom line here is that since Dobbs, even with the devastation, every single state in this country has taken action on abortion in some way, whether it is political, and we're seeing proactive policies trying to be passed, or it is reactive policies trying to protect and secure abortion access, or also healthcare opportunities to make sure that patients can get to care and care can get to patients. So I'm going to play this quick video just to kind of solidify what it actually looks like for a patient to access abortion care.
Since the Supreme Court took away the constitutional right to abortion, millions of people across the country no longer have access to abortion and are forced to travel outside their state to get the care they need. For many, the costs are overwhelming, if not impossible, to shoulder. Take Avery. Avery is a college student in Shreveport, Louisiana. Between school, work, and friends, Avery has a lot on their plate. Avery wants to finish school before even thinking of starting a family, but about a month after missing their period, they realize they're pregnant. Abortion is banned in Louisiana, so Avery must travel out of state for the care they need. Kansas would have the nearest abortion providers, but there are no appointments available anytime soon. The next closest health center is in Fairview Heights, Illinois, 575 miles away. Avery doesn't own a car, so they'll need to take a 13-hour bus ride from Shreveport to St. Louis, Missouri, and then a ride share to get from St. Louis to Fairview Heights. Getting to Illinois and back will cost Avery about $387 round trip. A trip that long means they'll have to stay the night at a motel, which will cost $75, plus around another $72 for meals. Using a rideshare to get to and from their appointment will cost about $24. Avery works part-time and earns the minimum wage in Louisiana, so they'll lose about $58 in wages during their time away from work. And there's still the cost of Avery's medical care to factor in. Since most insurers in Louisiana don't cover abortion care, they'll have to pay $550 for the procedure itself. So to get the care they need, it will cost Avery about $1,200, which is a lot for any person, but especially a student. And that doesn't even begin to measure the huge emotional toll these hurdles can take. Access to healthcare should not be based on your age, race, gender, income level, or where you happen to live. Learn how you can help make abortion more accessible for everyone at bandsoff.org.
So I would love to hear from folks, and I know not everybody can actually see in the chat, but we can see it on our line. What were some of the barriers or the restrictions or even surprises in this video that you heard? Some of the barriers or restrictions to abortion care that Avery was facing. Yeah, Amy shared 575 miles to the nearest clinic. Absolutely. The cost financially to travel and the emotional toll that it took. Loss of wages. Absolutely. Folks are having to find opportunities for childcare, right? Not just childcare, but also time off of work. And not just time off of work, but also those lost wages, right? Absolutely, Mercedes. Appointment availability. Absolutely. As more and more restrictions are in place, right? And I know we even experienced this in Ohio. Prior to my departure, I think 36% of our patients were coming from out of state. Obviously, in Cincinnati, Ohio, we're very close to Kentucky, but many patients were bypassing states because the time it took to actually get the care they needed. And when somebody's pregnant and doesn't want to be, they're trying to terminate the pregnancy as fast as they can. And availability, people are willing to travel farther, but obviously it makes it increasingly difficult to do it. Caprice shared the cost financially to travel, and not just the cost, but the emotional toll. And Mevi said no access to sick leave. Absolutely. Absolutely. All great examples. Thank you for sharing those. So this ongoing national fight that could ultimately impact access across the country, regardless of where someone lives, is the mifepristone litigation. And I do want to just name that, in 1973, MIFI was not the law of the land. And so although it is extremely devastating for people to not be able to access the abortion care that they need, there is a silver lining in all of this, and that it is that mifepristone and access to medication abortion is, as of right now, safe and of course legal in the United States. While the Fifth Circuit's decision could keep mifepristone on the market, it would turn back the clock on abortion access and impose medically unnecessary restrictions on the pill, which is the most common method of abortion in this moment, which is all more important, obviously, post-ops. So because of a stay issued by the Supreme Court earlier this year, I'm sure lots of people saw the news about the Miffy case or the mifepristone case. The Fifth Circuit's ruling and the restrictions it would impose will not take effect until the Supreme Court decides whether to hear the case. And if it does, until it rules. So for now, mifepristone remains FDA approved and available, which is a great thing. Last year, the Supreme Court's June 2022 decision to overturn Roe set off a whirlwind of legislative activity in Congress. Immediately following the decision, the House passed the Women's Health Protection Act for the second time, along with ensuring women's rights to Reproductive Freedom Act to reaffirm a patient's right to travel out of state to get abortion care, and the Right to Contraception Act to protect the right for patients to receive and providers to prescribe birth control across the country. The Senate also brought multiple bills to protect abortion and birth control access to the floor, all of which were blocked by anti-sexual and reproductive health care Republican senators. And I know sometimes, especially in a state like Missouri and Ohio, it was exciting to see what was happening in Congress, but also we knew that sometimes we weren't able to actually enact many of the bills because of the state-based restrictions, or that something was imminent upon us to continue to restrict access to abortion care. So in addition to extensive floor activity, champions in Congress have also held a number of landmark hearings, including a testimony for Planned Parenthood abortion providers and patients. They sent many letters urging a variety of actions to protect abortion access, and introduced a long list of new proactive bills aimed at protecting domestic and global sexual and reproductive health. So there were more than 50 pro-sexual and reproductive health bills that have been introduced since January alone, including many and around the first anniversary of the Dobbs decision. As the case was threatening nationwide access to mifepristone, as it's been working its way through the courts this spring, 253 members of Congress filed an amicus brief in support of the mifepristone access, which was the largest number of signers that we have ever seen for pro-sexual and reproductive health congressional brief, which was amazing. And there was a lot of celebration in that moment to see people come together to really try and protect reproductive health. So in short, I think my point here is that we and Planned Parenthood Action Fund have been working very closely with, of course, our affiliate partners across the country and champions in Congress to put a national spotlight on this crisis that has unfolded around the country since Dobbs, really using every single tool in our toolbox. But we also know that while the national strategy is critical, and we can't lose sight of making sure that we're securing access both within Congress, within the House and Senate, but also in courts, right? In the Supreme Court and in lower courts. It is really at this moment also left up to the states to make sure that we're doing everything possible to protect access to abortion care. We have also collaborated with the Biden administration to advance a range of pro-sexual and reproductive health care policies. Through this partnership, we have diligently worked to repeal many of the rules and regulations put in place during the Trump era, with a specific focus on expanding access wherever feasible. So I talked about this a little bit earlier, but I want to go into more detail because I think that this is it is heartbreaking, infuriating, and also fascinating to see the parallels. As you know, state legislatures conclude their sessions in the 2024 election cycle commences, the striking parallels between the battles for abortion access and transgender rights have become increasingly apparent. Republican lawmakers have introduced an unprecedented number of bills at both the state and federal levels aimed at restricting the rights to transgender individuals and limiting their access to healthcare. And although the scale and magnitude of these legislative efforts are unparalleled, the strategies being employed exhibit remarkable similarities. Drawing parallels with the anti-abortion playbook, it is evident that every single step of the way, the tactics used in these two fights bear striking resemblance. For decades, Republicans have prioritized restricting access to abortion as a key agenda item, as we went over earlier, right? Since 2010, really. But again, before that, effectively mobilizing their base voters around this divisive issue. However, in the wake of recent elections and changing public sentiment, abortion has evolved into a liability for Republican candidates. And they now know and now find themselves caught between anti-abortion advocacy groups pushing for more extensive bans and a growing number of voters who have rejected such policies. Today, a new issue has taken center stage in state legislators across the country. The GOP lawmakers have introduced a staggering 500, y'all, 500 bills that have directly impacted the queer community, with over 70 of them already signed into law. And according to the Human Rights Campaign, this is a deluge of legislation that has prompted HRC to actually, the organization, to declare a national state of emergency for LGBT plus individuals in the United States. It is crucial to recognize that we cannot have reproductive freedom, we cannot have reproductive justice without the fact that we have LGBTQIA plus justice, right? These fights and these movements are intricately connected, and we will not be free until all of us are free, right? We've heard that quote by the brilliant Audre Lorde many, many, many times, but it is true that all of these fights are intricately connected, and there is a very clear playbook that people understand and know exactly how to move those levers of power. We have connected the dots for supporters on the coordinated attacks of our rights on digital properties, obviously in person, on digital properties. There's lots of partnerships that have happened across the country to make sure that those dots are connected, and that to name that the same politicians and activists that are attacking abortion care are passing laws to punish trans children and their families. But the good news is, y'all, is that when abortion is on the ballot, abortion wins. We win, it wins, and people win, right? The pundits were wrong. Abortion rights was the game changer during these past midterms. It defied precedent, history. It propelled monumental victories for reproductive rights champions and abortion access across the country. We saw folks turn out and win in Kansas, in Kentucky, in Michigan, in Vermont, in Montana, in Nevada, in California, and we're going to have another win here in the state of Ohio. I know all eyes are on Ohio in this moment because abortion is on the ballot. And thanks to abortion, the United States has also preserved a majority in support of abortion rights that has blocked the threat of a national abortion ban. So I'm not gonna, folks can put this in the chat if they'd like, but I think just given everything that we've gone over from both the history of the history of enslaved women, right, and thinking about the founder of gynecology to the current moment that we're in from the last 10 years where abortion rights have been stripped away, to the fact that the majority of people in this country support access to abortion care, I want you to think about the upcoming election. And how does this issue of abortion, how do you think the issue of abortion is going to impact the Democratic Party's chances in the 2024 elections? How might the party's stance on abortion affect voter turnout and support among different demographics in the 2024 election? In light of recent developments and the shifts in public opinion on abortion, what strategies do you encourage the party or Planned Parenthood or the coalition, a lot of the work that's happened across the country, what strategies can we employ to effectively address the issues and appeal to a broad base of voters in the upcoming elections, recognizing that we've got to talk to everyone, right? Everyone is critical in this moment, and especially Black and Brown communities, young people, people who we know have to turn out to these critical elections. White women, right, who we've got to also make sure the message is really clear and folks are turning out to do their job and make sure that abortion is secured. So feel free to put in the chat what you think, and if there's any any ideas or suggestions that you have on how you think we can change the narrative and also shift the strategy in 2024. So we have been saying for decades that this is the most important time in the movement history to get involved, right? And I'm here to deliver the news that every single time we say that, it is true, and we mean it. That now is the moment to get involved. Now is the moment to do good work with whether it's Planned Parenthood, the broader coalition, and secure your ability to do work for reproductive rights and fight for the ability for people to access care. There's work happening in Ohio. I am going to go to Missouri here. Please, I encourage you to sign up. If you're a college student, if you're on WashU's campus, here is the handle for the Planned Parenthood Generation Action chapter that I believe is active at Worcester, and I'm sure they're doing some incredible work here in Missouri. Obviously, Planned Parenthood Missouri Advocates is here. Whether you want to get involved in Planned Parenthood, the broader coalition, a reproductive justice organization, you want to provide care and make sure that people can get access to care, now is the moment to do it. So I am just so elated to be here and to be speaking with you. I'm happy to take questions. I have a few more slides, but I think I would rather pause and make sure that we have a few minutes for questions before we close out. And I'll make sure Sarah has a list of resources and some links to some videos, as well as information on how to get in contact with me or Sarah, so that if folks have questions or need anything, I can be there.
Thanks so much, Kersha. And we do have a few questions, and I just want to apologize for the state of my camera right now. I know it's very on trend for Halloween, but it's probably very distracting for folks seeing the blinking. So I apologize. There at the end, Kersha, you talked about the importance of speaking to everyone, right? And trying to get the message across to everyone. And I have a question here from someone talking about parents who terminate a pregnancy for medical reasons. So TFMR, terminate for medical reasons. And, you know, noting that oftentimes those parents don't always see their heartbreaking options actually as a choice. And so she was wondering about, kind of to your last question, maybe about how can you advocate, how can you get the message out? Your thoughts around how the pro-abortion groups and activists can do a better job of bringing up instances of, you know, needing to terminate for medical reasons and those experiences, while making sure that they're also, you know, treated with empathy and making space for grief. And I think that also kind of speaks to, you know, the multitude of reasons that people do seek an abortion, and how can you advocate, but also use language and use tactics that, again, like the listener said, make space for grief, make space for feelings, make space for empathy.
Yeah, that is a loaded question, a very, very important question. And I know that there are some organizations on the ground. I'm not specific to Missouri, but perhaps we can find that, you know, that have made space for folks that, you know, are grieving because they wanted to keep a pregnancy, right? And I think the point is that there are so many variations as to why someone wants to access abortion care, right? There's not one story. There are so many different stories. And I think the important part in this narrative is making sure that we're elevating the stories that you shared. I'm not sure what the individual's name is that asked this question, but the stories that you shared, and simultaneously also elevating the stories of young people who may be in a different situation, right? Or the story of Avery, right? That was in a very different situation than wanting to keep a pregnancy. And so recognizing that all stories are valid, and no matter who you are, what your experience is, there are resources and love that you can get as you walk into a health center, whether it's an independent abortion provider or a Planned Parenthood. So I apologize. I don't know specifically what if there's resources or access in Missouri, you know, from some smaller organizations on the ground, but I'm sure there are some tools. I know Shout Your Abortion, if you Google Shout Your Abortion, there was some work that was also done on a toolkit, I believe, for folks that were kind of sharing stories and telling stories, recognizing that, again, everybody has a different story. And there are some folks that experience abortion care and wanted to, you know, we're hoping to keep and continue pregnancy. Good question.
Yeah, thanks for that. And Yeah.
I just saw Mevi had put in the chat, and yeah, feel free, y'all. If you know the answers to some of these, feel free to put them in the chat. But Mevi had shared Defending Grace is a website that talks about this, and the author is a Missourian. So Defending Grace, that's beautiful.
Yeah. All right. Another question here. I'm going to try to get through a few more. Well, we have a current student who asked this, and this student is a dual MSW and PH, so similar to your academic background. And they were wondering how your dual degree helped prepare you for this role, and then also how you maintain optimism to continue to do your work, or, you know, self-care, things like that, especially since your role can be very mentally and emotionally taxing. So any advice out there, kind of more from a personal standpoint for others who are doing this work or preparing to do this work?
I love that question. I would just quickly say, yay. I'm so glad you're doing the MSW MPH dual program. It was wonderful. I think my focus was on women in social and economic development, which obviously connects very closely to this work. I think a couple things. One, WashU's focus, or at least the time when I was there, on interdisciplinary approaches, recognizing that, like I said, right earlier, we understand the intersections of this fight, and that it is not just about healthcare, but it's also about people's social determinants of health. Can they access transportation? Can they access education? Can they access just, you know, the ability to actually get into a health center, childcare, et cetera? So recognizing that, I think WashU set me up to really understand the full gamut of, it wasn't just about healthcare, but there are so many different intersections when it comes to specifically reproductive healthcare that has a person's ability to access care no matter what. And what was the second part to that question?
Just how you keep your own sanity and you know, ability to continue your work.
Maybe that's why I forgot the question. No, I'm just kidding. I think I do a very good job. I try to, you know, keep my body moving and walk every morning. I take care of myself. I make sure I'm drinking my water, keep my face moisturized. My wife and I love to travel. That is, look, we know those quotes, right? You can't fill from an empty cup. So I really, really try try hard to make sure that I'm taking care of myself and my family first, before I can take care of everyone else. And this fight is hard, and it's a long one, and we've got a lot of work to do together. And so taking care of each of your own mental health. My therapist, I love her. She has got me through a lot over the last couple of years. So I'm a huge advocate to make sure that you're taking care of your mind, body, soul, and spirit to get through. And I just want to close with this quote. It is one of my favorite quotes. Lucille Clifton says, "Come celebrate with me for everything. Every day something has tried to kill me and has failed, y'all. We are still here. No matter what you're going through, no matter what your experience has been, we are still here, and we're going to still be here to fight for people's ability to get care and just be their happiest, healthiest selves." So thank you again, and it has been a pleasure.
Yeah, thank you so much, Kersha. And I want to apologize. I know there were like so many questions coming in at the end there, and I'm sorry we didn't get to all of them. A recording of today's presentation will be posted. I have a QR code up on the screen for you to find where that'll be. It'll probably be posted tomorrow, so give me 24 hours. And please do get connected with the Planned Parenthood organization and local chapter here in what direction are we? Northeast Missouri, to find out more about how you can get involved locally. I do also want to share, we have another open classroom coming up in March. That's March 12th. Entitled Losing Her Voice, Mental Health Implications of Abortion Restrictions. So this is gonna, I mean, kind of exactly what it says, focus on the mental health implications on women and birthing people and others when abortion restrictions are put in place. There will also be a focus on marginalized folks, people of color, low-income communities, and LGBTQIA identifying folks who are facing abortion restrictions as well. So there's a QR code to register for that if you want to kind of continue this conversation and this learning. So again, I want to thank you everybody for being here, and I want to thank Kersha Deibel, our presenter today, for taking time out of her very busy day to give us kind of the lay of the land of what's happening, both past and present, and hopefully in the future with abortion access. So thanks everybody for being here, and we will see you next time.
Thank you all. Take care.